name is Dr. Sherman Valero, and I specialize in Retina and Vitreous.
I am Dr. Milagros Arroyo, just like Sherman, and Dr. Arnold. My subspecialization is Retina and Vitreous.
Dr. Arnold Salud, same specialty, vitreous retina.
The best, I think, would be to categorize the diseases. There are those common diseases related to being sick, such as having hypertension and/or diabetes. And then we have those that cause central blurring. And then we have those that cause initial or your first symptom is blurring at the sides or the periphery. And let's make special mention of the diseases of premature babies.
Diabetic retinopathy is a complication of diabetes mellitus, and a big proportion of our population actually has diabetes. So this is from long-term poor blood sugar control, and then you get abnormal blood vessel growth at the back of the eye that can cause bleeding, leaking, and swelling, and eventually scar formation. So these are some of the more common complications of diabetes.
The retina is the part of the eye that gets involved in those patients who go blind. So treatment can be very varied, from saving your eyesight to improving your eyesight. So treatment can range from laser treatment to injection of medicine to surgery.
With regards to the diabetic retinopathy that we were talking about, do not wait for your vision to become blurred, because at that time the disease may be quite advanced. So the regular checkup when you have diabetes is one of the more important methods of handling the disease. And the myth is that patients come when they have blurring of vision only. Sometimes the disease is already too advanced.
One of the more common eye myths that we still see is that for infections in the newborn, they put mother's milk as eye drops. There's really no truth to that. So we hope our patients will learn not to do that. Don't do that. I think what's important to stress is that even if you're not having eye symptoms, you should see your eye doctor regularly. A lot of the eye conditions that we see sometimes don't have symptoms in the initial stages. So for patients, especially those who are over 50, for those who have other systemic conditions such as diabetes and hypertension, they should get regular checkups with their eye doctor so that we can screen for possibly sight-threatening conditions and prevent them from getting worse.
There are many things that affect the eye. In our case, the retina. And bottom line, it's either disease-related or age-related. So obviously, if it's disease-related, if you know that you have diabetes, the most common condition that affects the retina, even if you don't feel anything, you have to be checked. If it's age-related, even if you don't feel anything, but you're in the senior side, you have to be checked.
Talking about age, let's go to our premature babies. Also, if you have a premature baby, it's very important to have them have retina checks, either when you are still confined in the pediatric intensive care unit, or follow the advice of your neonatologist or pediatrician, because there is an animal called retinopathy of prematurity, which will cause blindness unless we catch it at the correct time. Prematures have a window of time where they have to be checked, and it has to be followed very strictly. So usually, if the baby is born at 30 weeks, within 2 to 4 weeks, we should check already. The mothers will be told about the schedule that has to be followed. It's very important that that schedule is followed.